Canada is on track to lose its measles elimination status as officials at the World Health Organization meet this week. They'll be analyzing our country's health data that tracks a surge in cases seen over the past year. So what could this mean for Canada and its healthcare system? Let's bring in CTV's medical expert, Dr. Marla Shapiro, now with more this morning. Good morning to you. So talk to us, first of all, about this measles elimination status and why it's so significant.
Well, between 1998 and 2000, the Americas, meaning Canada and the United States, had measles elimination status. This is a preventable disease. We have vaccines in Canada. They are free and available. And eliminating measles is critical because this is a disease that has high illness and high mortality. So measles free since 1998. In the past year, April to April, so we're talking the past year or so, we've had over 5,000 cases that have been confirmed. We've had 2 in utero deaths. That means moms that were exposed to the virus during pregnancies where the pregnancies did not go forward because of measles impacting the outcome of the pregnancies. The outbreak began in April of 2024 at a wedding, and then we saw it spread like wildfire throughout the country. There are some areas that are more at risk because of higher pockets of not being vaccinated, and that is really what we're talking about. If we don't get vaccinated, and we need to be vaccinated at about 95% of the population to have that measles elimination status.
So let's talk a little bit more about why we are seeing this surge. It seems to be in the news, it seems every other day recently.
Right, and although we seem to be trending downwards, you cannot have elimination status given back to you until you've had 1 year of no outbreak with robust surveillance, so continued and no sustained disease for at least 12 months, no continuous endemic spread. So endemic spread means that strain that was identified at that wedding in November in New Brunswick is still the strain that we're seeing. So it's endemic, it's within our country, it's being spread from group to group to group and being propagated by people who are not vaccinated. Those are mostly what we're seeing, and if they're the high risk or we don't know their vaccination status and assume that they haven't been vaccinated because the vaccine is very, very effective. So this is a preventable disease, and we don't just think about it as a childhood viral illness because it has such serious outcomes, and we've seen hospitalizations, we've seen those 2 utero deaths, completely preventable.
So what are the big implications then of losing this measles-free status? And you believe that the World Health Organization will take that status away.
We think that that's imminent, and then we're, you know, even though things are trending down, they have to continue in that direction with us getting back our vaccination status. So COVID happened, and we had lots of kids who were not seeing their doctors, their family doctors, their pediatrician, nurse practitioners, not getting their vaccines at all. And then somehow they were lost to follow-up. So typically we give that vaccine at 12 months, and then we give a second boosted value somewhere around 18 months up to 4 years of age. It's a 2-dose vaccination series in order to be able to be immunized, and it's typically given as a triad: measles, mumps, rubella. Those are the 3 that are all together in one vaccine. So we didn't get our catch-up status, and then we have communities that don't believe in vaccines or haven't been educated by vaccines. And as long as we fall below that 95%, it's such a wildly infectious, very good at transmitting from person to person illness that we've seen it take off as we have in the past calendar year. So we are seeing, without a doubt, more people going back to their family doctors. We are seeing more requests for these vaccines. We're trying to do a much better job at educating how safe and effective these vaccines are. We have years and years and years of data. You know, that mythical autism association has been disproven so many times. And this is an illness that has severe repercussions, including hospital admissions. You can get a measles encephalitis and inflammation in your brain, a measles pneumonia. This is not a disease that you want your child or you to have as an adult.
And I know we're just about out of time, but so many medical experts are saying, from your world, can't believe we're here.
It's shocking to believe that we're here because this is a childhood disease that since 1998 we've had elimination status. We've done a very good job previously. Yes, COVID has intervened. But there's no reason why you cannot get immunized now. Check your immunization status, know what your child is, know what you are, and whether or not you need to have a vaccine. This is a disease that we need to eliminate. Again, we don't want to be that part of the Americas that starts the change of losing elimination status that then rolls over to the United States and to Mexico. It's a big concern.
Dr. Marla, thanks so much. Really appreciate your time on this today.